Mayor, I still remember the dedication day when you came down to the third meeting of the day at 11 o'clock in the morning, I think.
It was on my second one yesterday. We're assembling my posse here.
Mayor, is it going to be all right to ask a question about the ambassador?
I appreciate those who covered the various 9/11 activities we did yesterday, particularly the CPR initiative that we have been working on for a while, but we did a mass CPR training at the Department of Neighborhoods yesterday, and I have instructed and will be following up to make sure that every city employee has that training, and appreciate our partnership with the American Heart Association and how use of the new mannequins is making it much more easy to do CPR. Just for anybody who might be watching, is interested in this, contact our Chief Services Officer, our volunteer activities here at the City of Houston. You no longer have to do the mouth-to-mouth. It's all chest compressions. It's easy to learn, and we need more people ready to save lives. And we did the mass training as part of our salute to 9/11 yesterday. I appreciate everybody who participated. The news item for today is the launch of Healthy Houston. This is something we've been leading up to for months now, in fact a couple of years, putting in place the building blocks to have a healthier City of Houston. We, as you know, have been working on issues of reducing food deserts, promoting the availability of locally grown foods, encouraging the development of sustainable food systems, but also working on activities to get Houstonians moving. In fact, one of the reasons that in this fall's bond election we have a significant component for hike and bike trails is part of that concept that we need to be more healthy in our eating. We need to also get out and move, and we want to make it easier to do that. In 2010, it was reported that 28% of fourth graders, 17% of adolescents age 15 to 18, and 29% of adults in Harris County were obese. These factors result in a decreased quality of life, increased medical expenses, and a shortened lifespan. Even in our own health insurance for the City of Houston, we made a transition from one insurer to another with the focus on wellness, preventive maintenance, and pushing our employees to take more control over their own wellness and on those things that they can control. The Food Trust recently conducted a study showing that Houston has fewer supermarkets per capita than most of the nation's large metropolitan areas. And we know that actually a lot of media stories recently about the lack of access to produce, to non-packaged foods in a number of communities. So all of these different initiatives that have been going on for some time, it's time to coordinate, consolidate, and try to bring it all together so that we can advance more coherently and consistently. So therefore, with the creation of the Healthy Houston Task Force, I hope we can do that. Two co-chairs for the task force are Dr. Margaret Kripke from the MD Anderson Cancer Center and Faith Foreman from our Health and Human Services Department. Dr. Kripke has been a volunteer medical advisor to the City of Houston since I became mayor, and has already shown her interest and enthusiasm and her passion for making sure that this is a healthier community, and I'm glad that she's agreed to take on this initiative. And of Faith is one of the people who helped to drive us within the city of Houston. We have 22 task force members, although anyone who is excited and interested in this issue, I hope that they will contact us and we'll put them to work as working groups under the task force. But these 22 task force members will work to recommend and implement specific actions, can't speak today, to reduce the incidence of obesity and its health and economic impacts, including encouraging urban agriculture, improving access to the healthy and affordable and locally produced food, supporting education regarding the physical and mental health risks of obesity and the benefits of consuming fresh fruits and vegetables, and enabling programs that increase physical activity and exercise. They will build off of the existing activities that I mentioned, the Community Transformations Initiative, City Hall Farmers Market and farmers markets at our multi-service centers, our vegetable container gardens, and the work we're doing with neighborhood associations to create community gardens, our grocery access task force, working with grocers on providing better economic tools and incentives to take care of food deserts across the city of Houston, and even expanding our bike share program in Houston. And as I mentioned, the expansion of hike and bike trails with the bond election that we're taking to the voters. I know that some of the members of the committee are with me today. Two council members who have been passionate about this issue long before they came to council. Councilmember Christie and Councilmember Costello, who has, I gave the responsibility to Councilmember Costello of working on the food desert issue for the city of Houston, along with support from Councilmember Adams, so I'm glad the council members are here. Dr. Faith Foreman, co-chair, Scott Howard, a volunteer from John L. Wortherman and Son, of course Laura Spangen, the sustainability director for the city of Houston, and Dr. Shrila Sharma, assistant professor at UT School of Public Health. Additional members who are here, Lisa Mellencamp and Bill Long. I will invite Faith to come forward and talk a little bit about how she envisions this task force working.
Thank you, Mayor. We're indeed excited this morning to launch the Healthy Houston Task Force. As the Mayor stated, we have already begun lots of work in the Houston community through our gardens, through our farmers markets, through our many activities focusing on wellness. The task force is looking forward to actually bringing all those things together, closing that loop, and actually making Houston a healthier place for people to work, live, and play. We're excited about the partnership with all of the various entities because obesity and chronic disease really is a problem that affects every Houstonian in every community. And it's going to take all of the stakeholders that you see behind me, as well as those that we will bring to the table to reduce our prevalence and the burden of chronic disease in Houston. So as we move forward, we will continue to enlist additional partners, bring them to the table, and try our very best to include all Houstonians in making Houston a healthier place for us all to live, work, and play.
Thank you. And we have another member who's here, Altura Jackson from Metro. Appreciate him being here. Do you have any questions about the task force and the work the task force is going to be doing?
Mayor, how do they define obesity and what are they looking for in defining obesity as opposed to body, as it relates to body mass?
Okay, and I may ask Dr. Sharma to chime in if she has any additional information, but there is a definition of obesity related to BMI, and it varies for adult males and females. Typically, scientifically, we use that BMI definition. However, BMI is the measure that is used for the average person, and it can vary based on race or ethnicity. Defined in most communities, for women, a BMI above 26 will say that you're overweight. For you to be obese, it's 30. and 31 above for males and females. So if we use the BMI number, those are the actual numbers. However, depending on how your weight is distributed and maybe some of the chronic conditions that go along with that, you know, there's a more subjective kind of definition of obesity as well. But those are the numbers for the objective measure of obesity.
The objective measure of obesity is what has brought us to this point, but you don't have to be technically obese to not be at your optimum weight. You don't have to be technically obese to benefit from better eating habits and more exercise. We all know that many of the issues that shorten our lifespan and impede our quality of life are things that we can control. What we eat, what we drink, whether we smoke, and whether we exercise. All of those things are within our control, but a lot of times it takes help to make sure that we do the right thing. We're going to try to coordinate better the resources that we have. This is not something where the city is going to launch a range of new initiatives. We have ongoing initiatives, but we also have a lot of community partners who are focused on the same thing. The time is right. There are a lot of synergies out there. We want to make sure we move it forward.
Mayor Parker, does Houston find itself on any dubious health lists among major American cities these days?
Fortunately, all of the lists that I have seen recently have to do with the fact that Houston has a great economy and we're the place for young people to come and start jobs and we're the coolest city, not the fattest city, and so I'm going to keep it that way. Anybody else? Well, I appreciate the members of the task force who are here with me today. Look forward to working with them as they develop further the initiatives we've already started and look for partnerships across the community. So thank you for being here.